Welcome everyone to today's WAS monthly webinar presented by the WAS Sexuality Education Committee. Our topic for today is insights and trends in out-of-school comprehensive sexuality education for the Africa region. My name is Renee de Klerk and I am the Executive Director of WAS. I'm delighted to welcome you to yet another WAS webinar. The World Association for Sexual Health is dedicated to advancing sexual health, rights, justice, and pleasure for all. Through these webinars, we aim to share knowledge, encourage discussions, and engage with experts worldwide on critical issues affecting sexual health. Before we begin, I am just going to give a few housekeeping notes. I'm going to read them because there's quite a few, so just bear with me. Okay, please let us know where you are joining from. So just in our panel today, we have representation from all over the globe, and that's usually the case with our participants as well. So please type in the chat where you are from so that everyone who's joining us today can see where we are all represented. This webinar covers sexual health topics, so please confirm that you are older than 18. The views shared today are those of the speakers and may not necessarily reflect the official position of WAS. We follow the WAS Sexual Rights Declaration. Our information is evidence-based, inclusive, and culturally sensitive. Captions are available and live translation is available in multiple languages. Please select your preferred language using the interpretation button. We encourage engagement, so please use the Q&A box for questions and the chat for general discussion points. We'll try to answer as many questions as possible after the panel discussion. WAS promotes informed, healthy, and positive sexual behaviors for all. A recording of the session will be available and shared via the WAS newsletter after the event. Stay connected with WAS. Consider joining WAS as an individual or organizational member. And don't forget to visit our WAS events page to read more about upcoming events of WAS. It is now my honor and privilege to introduce you to the WAS Vice President and my dear colleague, Esther Corona. Esther, welcome, and you take over as the host for today now. Thank you.
Thank you very much, Renee. I am absolutely delighted to be in this webinar and to welcome all of you and give you a greeting, a good morning, good afternoon, good evening, wherever you are. I'm very happy that this is the culmination of a series of webinars that we have been carrying, and also it's shows it highlights some of the research that we have been carrying at WAS worldwide on out of school CSC in partnership with UNFPA. So it's absolutely marvelous to have you all here. I have just seen that we have an audience, a worldwide audience, and this is the first webinar on this series of out of school CSC. And today we are focusing, highlighting the Africa region, which has such a rich experience in the topic. So with much further ado, and trying to cover and to hear as much as we can from our experts, I'm going to ask our speakers to introduce themselves now to really do justice to what they do and their worldwide experience, in many cases, their local experience. Their full biographies will appear on the chat, and you're welcome to revisit this webinar once it's finished because it will be recorded and it will stay available for you. So please, can we hear from you? First of all, Elizabeth Schroeder, who's in United States and from the United States, and not as was stated in the initial phases of this webinar, from South Africa. Elizabeth, please, can you introduce yourself briefly and tell us what you do and a little bit about yourself?
Certainly. Thank you so much, Esther. Good morning, good afternoon, good evening, everyone. My name is Dr. Elizabeth Schroeder. I am an international CSE consultant, both on in-school and out-of-school CSE. I have done work with the ESARO office of UNFPA and many other UNFPA offices around the world. So I am familiar with Southern Africa as well as Northern Africa, having done some amazing work with the wonderful folks at UNFPA in Tunisia. So it's just an honor and a privilege to be here. Thank you all for spending your time with us. Over to you, Esther.
Thank you very much. James Tumusiime, I hope I'm really more or less speaking well, doing full justice to your surname. James Tumusiime from our East and South Africa region office from UNFPA in South Africa. James, over to you.
Thank you very much, Esther. The name is James Tumusiime, and I work for the UNFPA East and South Africa Regional Office. I'm happy to be here. I am very passionate about issues of young people, especially comprehensive sexuality education, and I have been engaged with the subject for coming to 20 years. I have field experience from Uganda, where I have worked for the longest time. But I have also worked in a few other parts of Africa, especially the East and Southern Africa region, having worked and supported work of institutionalizing CSE in countries like Lesotho. And I have a lot of learnings from ground experience, grassroots work, working with civil society, working with governments. And I'm happy to be here speaking to a very wide audience as this is this afternoon. Thank you very much.
James, I'm really excited to hear about all your work and all what you have been doing, having had such a wide experience. And now may I turn on to Amina at Alidi from Malawi to tell us a little bit about herself. Amina, over to you.
Good morning, good afternoon, and good evening, everyone. My name is Amina Alidi. I'm a Malawian social work profession, UN volunteer, and also youth development advocate with strong experience in gender equality, community engagement, and also research in policy communication. I've held prominent youth leadership roles, including the Vice President of the UNFPA Malawi Youth Advisory Panel, a youth delegate and speaker at the UN General Assembly, and also I'm a member of the EU Youth Sounding Board. I have worked with organizations such as UNFPA Malawi, VSO, Health Policy Plus, Propel Health, and also the UN Youth Office on programs related to ASRHR, GBV prevention, community mobilization, and advocacy. I'm currently serving as an advocacy and outreach assistant with the UN Volunteer Program, and I support national efforts around the 16 days of activism against GBV. I'm very passionate about elevating youth voices and also advancing the rights of women and girls. Thank you. Over to you, Esther.
Thank you, Amina. And just to complete the introductions, I'm Esther Corona. I'm from Mexico, and I'm currently in Mexico. And I have been working in gender, comprehensive sexuality education for 60 years. So I have covered almost all the globe, and I have been privileged to work in Africa, in South Africa, and other countries. So I'm really very happy that we have this opportunity to hear about all what you are doing. So we're going to have a very open dialogue and hear from our experts. And from Elizabeth that will comment on some of the on what is reflections coming from our speakers, and then after that we hope to have, of course, some engagement from our audience, and we will have a period of questions and answers. But first of all, I'm going to ask a round of questions, and I ask you to be brief, to the point, but give us as much information as you can from each of the topics that we are covering. First of all, I would like to ask Amina and James. You have already told us where in Africa you're working, but if you would tell us more about the context of where you work, what do you do there? What is your um, relation to CSC and out of school CSC in your work? So if you could tell us a little bit more, I would be. Um, I think our audience would be very interesting in to hear what is the context you're working in out of school CSC. Amina, first, can you tell us a little bit about what do you do?
Thank you so much, Esther. So basically, my work is mostly with out-of-school youth, including adults and mothers, youth in fishing communities, youth networks, and also community youth clubs. I deliver CSC in community settings like the youth clubs, the informal peer education forums, village meetings, and also. So rather than schools, precisely because these youth are excluded from formal education, and my engagement includes community sensitization on ASRHR, GBV prevention, digital safety, and also facilitating dialogues on sexual and reproductive health rights. Thank you. Over.
Thank you, Amina. So you are not only a young person, but working with young people themselves. So it's I really would like to hear much more about your experience. James, can you tell us a little bit about your work? It's so extensive. I know it would cover a full webinar, but if you can summarize and give us an idea of the context that you work in.
Thank you very much. I think that question could be answered in twofold. I'll start with my current role at UNFPA. So, of course, for UNFPA, sexual health is really an issue of life and death. For us, we believe that it has to contribute to the work we do of reducing maternal death, of reducing GBV, and of reducing harmful practices, but also preventing HIV. So in that regard, my job is really about how comprehensive sexuality education can be linked to sexual reproductive health and rights services. So it's my job to support integration within existing programs and those that we are yet to get. It is my job to work with countries to make sure that we have sufficient capacity to have targeted programming where we have, for example, curricula to train teachers, working on issues of parent-child communication. We are working on issues of funding. I think the fundamental issue is CSE something that is fundable? Is CSE something that is integral to development? Is CSE something that is welcome in Africa, and why? So for me, it's really to put down this in the simplest possible way when I communicate to whoever I communicate to live knowing that CSE is integral to development, CSE is integral to the well-being of young people, and it is very important for Africa as a region, especially. We talk about issues such as the demographic dividend. We talk about the education for health and well-being. We have a lot of young people in Africa that drop out of school. In some countries, it is as high as 90% of those who enter grade 1 to those who reach graduation. And sexual health has a lot to do with these young people dropping out of school. So we need to have this integrated at every point of planning for the human capital of Africa. And that's part of my job, to work with the team, and we make this messaging as simple as possible. Thank you.
Thank you very much, James. It's I think that you really have summarized also the World Association for Sexual Health points of view and approach to sexuality education and out of school sexuality CSE. I wonder, Elizabeth, if you could give us just a very short reflection on the importance in worldwide and what we have found in Africa about out of school CSE.
Absolutely. Thank you, Esther. So worldwide, out-of-school CSE, and this has been for many, many decades, out-of-school CSE has been particularly important in reaching the most vulnerable, the most marginalized, the most left behind young people. In our current work, Esther and I and Renee have been working very hard to collect research and data, both formal peer-reviewed and other kind of data about what is being done around the world. And of course, we're focusing in on the African continent right now. So in terms of what we've been seeing is there is a great deal of work being done in out-of-school CSE. The African continent is huge, but I will say that there is a lot of leadership that is coming from, in particular, East and Southern Africa and also Northern Africa in what is being done and how we are reaching people, young people, and also their families. So Amina was highlighting the importance of parents and caregivers. I'm going to highlight three really quick points from the research and then that we've been doing, and then hone in on Africa and have our colleagues do that. First and foremost, the work that is being done around the world is a lot of sexual health provision. There's a lot of guidance from international documents and resources about the need for comprehensive sexuality education. And one thing we know that while there are huge, huge opportunities for providing CSE in out-of-school settings and the importance of partnering with in-school folks, of making linkages to sexual and reproductive health sources and resources, when we think about what is comprehensive sexuality education, where it is based in a curriculum, it has numerous sessions, that is sometimes most challenging to provide in areas with the most vulnerable and left behind young people. For example, humanitarian settings where the population is often transient or impacted by war or conflict or severe weather issues. That's one of the things, in particular, when we think about reaching sex workers, when we think about reaching LGBTQIA plus youth and young people, when we think about reaching young people with disabilities, if they don't have access to coming to repeat programming, that's a bit of a challenge to get them in there. So while there is a lot that is being done, it's very important that we look for the opportunities and make sure that we continue to reach the most vulnerable and left behind folks. So I hope when James and Amina are speaking, you can speak a little bit to those needs as well. And then just briefly, what we are seeing in the last 5 years, the whole world changed because of the COVID-19 pandemic and the shutdown. And this connects to, first and foremost, the vulnerability that was affecting many young people was heightened because of that. A lot of young people were isolated. We couldn't do community-based programming, which is the heart of out-of-school CSE. And once again, because we were all dedicated and devoted to this work, we found ways to work on this and to still get out of school CSE to young people, thanks in no small part to the leadership of young people. So that's when we really started using technology more creatively, more intentionally. And a lot of that leadership came from young people. Let's create a WhatsApp group. Let's use this type of social media to get to each other. And this has been starting over the last decade or two, but it really heightened. And that leads me to my third brief point, which is we have seen an explosion now of the use of technology in order to provide, I'm going to say, sexuality education, because we haven't yet seen how comprehensive we can be in using technology. So I would see that as one of the most exciting opportunities coming up, which is how do we use technology, which is so important and valuable and valued in young people's lives, and also has many downfalls because there's a lot of misinformation, disinformation, and some concerns about emotional and mental health and the impacts of social media consumption on young people's health and well-being. But more than anything, it is such an opportunity to be able to reach young people both throughout the African continent and region, as well as worldwide. So I will pause there, and I hope, Esther, that was useful to you, and I will turn it back to you. Over.
Thank you very much, Elizabeth. Yes, you have done a very good job in highlighting and explaining the worldwide universe of out of school CSC, which is so broad reaching that sometimes, it's daunting in terms of how are we going to reach such different populations. But I'm sure that both Amina and James are seeing some emerging um, trends or themes that you're noticing in your out of school CSC work. Amina, can you tell us what you seeing as the most important trends or the most important new issues that are coming up in out of school CSC in Malawi and where you work?
Thank you, Esther. So through my work, several critical and recurring themes have emerged. For example, we have the adolescent pregnancy and early motherhood. In Malawi, teenage pregnancies remain very high. That the 2024 national survey shows an increase in teenage pregnancies that rose from 29% in 2015 to 32% in 2024. So many of these young mothers we reach have dropped out of school and lack access to ASRHR information or youth-friendly health services. And also due to this, because a substantial proportion of girls marry before 18, basically in Malawi and in Manguch, where I'm staying, many youth schools urge increasing demand for out-of-school CSC and support. And many out-of-school youth report exposure to gender-based violence or sexual violence, including forced early marriages, intimate partner violence, or digital abuse. There is a very wide knowledge gap around consent, contraception, mental health. We talk of digital abuse, we talk of youth-friendly health services. Many youth lack information, leading to risky behavior, unintended pregnancies, or also low uptake of services. Therefore, youth leadership and also peer engagement is very potential, and I observe a rising willingness of among youth to engage, lead, and also discuss SRHR gender issues in peer groups, youth clubs, and also the community forums. And there is evidence that youth-driven outreach can work. So from my own facilitation, many club members are really stepping up as peer educators, sharing information with their peers and raising awareness locally. Since most young people actually are based in the rural areas, so it is very hard for them to acquire this knowledge, to acquire the important information. So I think it is very important that we train as many peer educators as we can, so that we can also include those marginalized people that are also in the rural areas or hard to reach areas. Thank you.
Thank you, Amina, and thank you for mentioning work that has been going on everywhere on early pregnancy unintended prevention. So, and also to mentioning these knowledge gaps that we have. James, could you please give us an idea of what are the emerging issues, trends that you're seeing in the region that you work in? It's so. I mean, you may want to cover specific countries, or I mean, I give it to you because your sub-region is so enormous that it's. I'm sure that it shows also some local variations in terms of and specificities in the work that you do.
Yeah, thank you very much, Esther, for pointing that out. Indeed, the ESA region is a very diverse group in its own right, with Southern Africa and Eastern Africa having quite different patterns on how they address issues of sexual health and sexuality education, coming right from the political divide in terms of how they have taken on, for example, the ESA commitments, the East and Southern Africa commitments, which were a key milestone in promoting comprehensive sexuality education, youth-friendly services, issues of policy, funding, etc. It has been more accepted, and governments have taken it on more in the Southern Africa region. Although, also to be precise, is that a lot of work happens even in the East African region. So in terms of some of the key things that I imagine it is also about the diversity of the young people that we are talking about, who is actually being reached and how are they being reached. We are talking about a region where issues of early marriage are still very, very rampant, with over 30% of young people still getting married while young. And now that means that they are going to be out of school. And in many cases, given a lot of people, young people live in the rural communities, issues such as the digital divide also become very critical when we are expanding our reach, and our reach is coming through the digital media, where a lot of innovation has gone through in most recent days. We are leaving out perhaps the most affected group. So we still have to focus on deepening interpersonal interventions to the most affected groups of young people. The other issue is also around what are the issues now and how are they being addressed. So you have heard my colleagues speaking about early unintended pregnancy. This remains one of the critical issues. Now, what are the root causes that come to lead us to early unintended pregnancy, to a lot of gender-based violence and child marriage? These three are some of the most persistent issues in the region until now. So the root causes are really about how we are able to strengthen our CSE work to address gender inequalities that are perpetually the root causes, but also how we are able to expand our work to integrate and look at how we come out of poverty as a region, but targeting especially the young people that are in many cases suffering consequences of poverty that end up into issues of sexual health. So that's a key issue that programming in the region is taking on, to make sure that we are integrating sexual health, economic empowerment, and services in the same goal. So these are critical things. Then the other issue is not defining adequately the macro picture of the interventions around sexual health. I think I began by talking about that. In many, many societies, sexual health is a taboo. Sexual health is a preserve of certain sets of rules. It is until, as societies, as political actors, as leaders in different spaces, we are able to elevate issues of sexual health to issues of macro nature, to issues that are important to talk about when we speak money, when we speak development, when we speak economic transformation of Africa, where it is not an issue that is associated with the, largely issues of morality, where we're able to relate teenage pregnancy with development. In Africa, for example, coming from the country that I come from in Uganda, we're speaking about, in Uganda, we have approximately 35,000 new HIV infections per year. And to keep people, we are talking about 1.5 million people that are living with HIV. The cost of taking care of people that are living with HIV in Uganda shillings is about 1.2 trillion Uganda shillings. That is almost a tenth of our national budget. And that money in the most has been coming from external funding. In the past, a lot of work on prevention has gone down significantly, focusing on the treatment, which is actually a higher option. So we need to strengthen CSE. We need to strengthen sexuality education on the perspective that it has a lot of dividend in saving the country, a lot of cost on taking care of people that have acquired HIV. So these are things that are very, very critical, and we need to appreciate them at that level. Another emerging theme is the HIV literacy. HIV/AIDS literacy has actually stagnated and in some cases gone low. And very, very key is the issues of how we talk about condom use, condom behavior, and how we promote. So the learnings are that the current generation of young people, we need to think a lot about how we promote positive behavior from a perspective that they relate with, from a perspective that creates admiration, not from a perspective of generic programming. So these are things that we have to integrate in our CSE to make it fancy, to make it attractive, but to make sure that we are using young people to tell us what drives their behavior, putting them at the front of designing interventions with us, and telling us what is working and not working. We have a lot of modeling that has been done in the past. Some of it has been overtaken by effect. So I think in one of the learnings that I've been through most recently is asking ourselves, how can we learn from brands that are still selling and selling successfully to young people, such that they are able to tell us how they have kept young people glued, and then we are able to make sure that the CSE we are designing actually works and works for a long time. Thank you very much. Those are some of the thinking processes, really.
Thank you, James. You have covered so much ground that it's very, very difficult for me to highlight on some of the points that you have touched. But anyway, I think that some thank you for linking also with HIV and seeing how it's still a very important issue to be dealt with, and it's because in some cases it's forgotten. And another thing that struck me about your participation is something that we have been discussing just a week ago with a worldwide audience in terms of how necessary it is to place CSC within the wider topics. As you say, I love the macro issues way that you put it, the macro, how it fits into the economy of a given region or of a given country, and also how political setups are either facilitating or factors that inhibit or hinder the actual delivery of CSC. So that leads me to ask first of all, Amina, and then James, to please comment on these factors that in your own setting, in your own country, in Malawi, are facilitating factors for the delivery of CSC, and which are, in your view, from your own point of view, those factors that really, really are obstacles in the delivery of CSE out of school. Amina, over to you.
Thank you so much, Esther. So, the presence of strong youth clubs and also community networks significantly facilitate the delivery of out-of-school CACs. And these structures act as natural gathering points for out-of-school youth and also provide familiar, safe environments to hold discussions. In Malawi, youth clubs and community hubs play a very critical role in ensuring that the sexual reproductive health rights messaging is accessible even to those living far from formal learning spaces. So, partnerships with organizations such as UNFPA, VSO, CBOs, and also local NGOs also create enabling conditions. These partnerships help with mobilization, training, provision of materials, and coordination of these local authorities. And most importantly, this multi-sectoral approach strengthens the overall reach and also quality of the out-of-school CSC and aligns it with our broader national priorities. And most importantly, for sustainability part, we also work with the communities or the community leaders and the traditional leaders in our districts. So community leadership is another powerful factor here in Malawi, like the chiefs, the faith leaders, women's groups, which we call the mother groups, and also other influential figures often help reduce the resistance by openly supporting CAC activities. Since in Malawi, like talking about sexual health or anything to do with sexuality, mostly it is considered as a taboo. Like young people are not supposed to be talking about such issues. So when leaders demonstrate like the acceptance, that you feel more comfortable attending these lessons, and also parents feel less threatened by discussing or attending any discussions around sexuality. And lastly, the use of localized approaches. We use the local storytelling, the local languages, interactive methods, and also peer-led facilitation. This helps them to ensure that information is also relatable and also easy to understand. And these approaches help overcome literacy barriers and also cultural sensitivities and make learning more engaging for youth from diverse backgrounds. Thank you so much. Over to you, Esther.
Thank you, Amina. And really, you have given us a very good panorama of what goes on in your work, and how, I mean, how easy or difficult it is depending on circumstances and context, and other factors which seem sometimes foreign to the actual delivery of CSC. And James, could you expand on what you have already been telling us about these facilitating or obstacles that you're observing in your work in the different countries that you work in? Please, can you tell us a little bit more about what are these factors or determinants of what you you do.
Thank you very much. I really appreciate the presentation of Amina. She has touched on some of the critical field items. Coming from another perspective really is to say a lot of things get done when the politics is right. A week ago, we launched, we actually had the review of the 2022 to 2024 ESA commitments report. And a lot of progress has taken place in the last few years in the region. And those countries where the politics has been favorable, the countries that have signed up to the ESA commitments, the countries that have accepted, the progression is much more significant. We have a lot of multisectoralism. We have a lot of integration of CSE into school curricula. We have a lot of community service work that is now integrating CSE because the countries have accepted this at that level, and the technical people are finding a conducive space to continue to do this work. So that's very, very important. We have regional bodies like the SADC community here, which have taken it a notch higher by standardizing tools. They have a scorecard on scoring reproductive health services and guiding the member states on how to program around these. So those are very important things. Then the other issue is really around coming from the same. Agencies such as UNFPA and other UN bodies set a sort of guidance, a sort of normative function for how countries can program, especially around the Sustainable Development Goals, to the extent that in the ESA region, out of the 21 countries, 14 countries have signed up and 7 haven't to the ESA commitments. But even those that have not signed up, because the guidance on how to implement the SDGs is coming from a central place, like the UN, they are actually ultimately implementing the recommendations of the ESA commitments because of that kind of normative function that has been set by organizations like UNFPA and others. So it's very, very important that the guidance from these institutions continues to come out and support how countries move towards the Sustainable Development Goals. The other important piece that has evolved in Africa, especially over the years, is the growth of public health practice beyond clinical care. There is a lot. For example, we have the Africa CDC that is trying to institutionalize in many countries, and this is taking health beyond the hospitals, beyond the clinics, into the public. A lot of training in the past, especially supported by the previous USAID, has built institutions' capacity in countries to look at the broader spectrum of issues that affect health. And in those issues, such as sexuality education and reproductive health in particular, have been prioritized. So this is very, very important. And for us at our end, for example, that's how a job like mine comes up, linking CSE and ASRHR services, because then there is a recognition that the information provided in schools, the information provided in the public health sphere, in the communities, has a direct linkage to influencing health outcomes, can lead people to appreciate and take up health, eventually can lead us to so many good benefits. Because in many African societies, it had never been a problem that people have so many children. And we had normalized that mothers will die when they are giving birth. These are things that we need to unlearn. And how do you unlearn them? Strong public health programming with a lot of communication, with a lot of examples that have worked, with a lot of people that are speaking about this, can transform this kind of social attitudinal shifts. The other issue is also around the emerging champions within communities. I know that the resistance remains a lot. There is a lot of pushback on the work that we do, but also the results are clear in many spaces. There are people that have taken on the approaches that we're using. They are promoting reproductive health, and the dividends are high. So I think for me, it is how much we remain committed, we remain invested in making sure that this work continues to move unabated. A lot of results over the years in almost all the countries have been seen. We need to pick these candles of hope wherever they are and amplify them, magnify them, because then the actual difference comes through them. And very important also is the participation of affected persons, beginning even before COVID and then in COVID. There is no one today who can underestimate the capacity of young people to transform their fate, the capacity of young people to innovate around what works and what doesn't work, the capacity of young people to believe in other young people and then accept that we can take this one. Where I sit from, I don't think I know the language that young people are using today, even if I try so hard. but as a matter of fact, pick on another young person from the same space, they will understand. So how much we evolve is how much we bring young people, bring the so-called knowledge that we have attained over the years, give it to them, and then allow them to transform it into products that they can use. Having knowledge, having research is a great thing, but transforming that research into products that people you don't know how to reach can actually understand and use it is a whole different ballgame. It is something that you can only send a messenger who is like one of us, and that messenger has to be equipped, has to be resourced, has to be prepared. It is not an issue of involvement. Involvement is when you call a young person in and they're part of you. No, this is an issue of transferring our skills and transferring ourselves, building the trust that the young people can change the tide. These are some of the very important things I would think about at this point that we need to pay attention to and as critical barriers that can be taken care of. Thank you.
James, thank you so much for pointing out to the transformative effect of youth participation in CSE, both in and out of school, and also the differences that you're observing according to political shifts within the region itself, which is no different to what we're observing worldwide. Of course, each country and each region has its own specificity. But Elizabeth, I would like to hear some comments from you on what have just been said by Amina and James about these emerging trends and topics that we are listening, and very much about the facilitating and hindering factors in delivering CSE out of school.
Absolutely. Thank you so much, Esther. And James and Amina, thank you so much for sharing your perspectives and your experiences. And I sort of can't help myself. I keep nodding along because everything that you were sharing is this is what we're also seeing worldwide in terms of what's going on, what's valued. Certainly, having young people meaningfully integrated from the beginning of programs as opposed to an afterthought, meaningfully including the specific populations of young people who we are aiming to serve, making sure they're a part of it from the very beginning in terms of programming. Also, when James, I was thinking about what you were saying in terms of support and communication and what are the products that we use. Another thing that we have been hearing throughout the African region is the importance of reassurance to parents and caregivers and community leaders, faith leaders, that so much of what is CSE they're already doing. It's part of adolescent and young people's development. So it's not a big controversial thing to teach about boundaries because we've been teaching young children about boundaries since they were very little. And so this is just one part and a very important part of their development. So that's very, very important. And I appreciated also, Amina, you lifting up training for young people, especially peer educators. This connects to me too, and I don't know if either of you wish to speak to this as well, the importance of giving support to peer educators and in general facilitators of CSE around what trauma-informed CSE looks like. And there's trauma-informed, which really focuses on the young people because so many young people have already experienced trauma by the time they've gotten to our CSE workshops and have been working with us. And also what is referred to as trauma stewardship, which is there are so many professionals providing CSE who have also experienced trauma themselves. So aside from the COVID pandemic, which was a worldwide trauma, we are seeing again and again how many young people are experiencing sexual trauma from very young ages. Is this something, James and Amina, you have been seeing with the young people you work with as well?
Amina?
Okay, seems she's missed it a bit.
Yeah,
Can you
my network glitched a bit. Do you mind repeating the question?
Certainly. I was saying that a trend that we have been seeing, whether it's throughout the African continent or worldwide, is the need for trauma-informed care, that there are so many young people who come into our programs who have experienced sexual trauma, sexual abuse, gender-based violence, and that has an impact on how people learn and how they can take in information and process information. Also, that the professionals, those of us who are facilitating these workshops, may have experienced some kind of trauma. So have you been seeing that, Amina, in the young people or the adults who are working with young people where you are?
Yes, of course. I've come across a few incidents, but I would say most of the people that are affected are the young people, probably, because I would say we have less trained professionals who deal with trauma responses and also psychologists here in Malawi. So in such doing, I think we have like a less amount of service providers that we actually work with here in Malawi.
Thank you. I
I'm
really want
audible.
to. You hear
James,
me?
yes.
Yeah, I want to relate with both Amina and, of course, appreciate the question from Elizabeth. A lot of violence from especially the familiar people in someone's life is normalized to a very great extent. And it's one of the perpetual reasons why violence keeps replayed generation after generation, because then people have not learned better. Abuse of power is an issue that people learn and they don't know better. Our communication, for example, in the mass communication world, should be very, very deliberate to be positive. A lot of times we're using communication, even as professionals, that reinforces abuse instead of showing alternatives that people should learn from. So a lot of the trainings that we've done many, many times are deficient of alternative good behavior that can be modeled to prevent violence and to support people that have been violated to actually come out of it. So I think for me, it is a deficiency, it's a deficit that we need to address. As a continent, we are very, very low on professionals, especially in the psychiatric and psychology domains. And therefore, we have to make sure that the public health that we do strengthens these professionals, strengthens the para professionals in these fields, and specifically portraying alternative good behavior. Otherwise, people, because of the taboos that we have, are not likely to speak out. But certainly, even if they don't speak out, they will act. They will act because they have learned from their past. So we have to be very, very deliberate to promote positive communication, modeling for positive behavior, and recognizing. I think a lot of programming in the past has been very deliberate on integrating SGBV. Some of it has gone as far as having checklists. I think these are things that should be routine into the healthcare system to screen people, to be aware if people have got help. And I think for me, it's a long way for us to go, honestly speaking, looking at the rates of intimate partner abuse, the rates of sexual violence, etc. There is a lot that has to be done in that area. And it is very, very grounded because, like, even in the report that I was talking about of the ESA commitments, GBV remains one of those perpetual things in the region. Yeah.
Thank you very much. We have two questions from our audience that I would like to ask you. This is Justin Hancock. It says, thank you for this excellent seminar. Is there a role for CSC websites, such as my own, he mentions, in helping to plug some of the gaps for young people and adults? And is there more of us doing online CSC guidance can do to support people on the ground? Can you comment on these, please? James and Amina, I don't know who would like to go first.
I will go first, and thank you for raising that. And I have shared in the past that you see what work online does, especially for audiences that don't have actual access to online, is that it sets the trend, it sets talkability. We need to make sure that we are able to tap into communities using people that have the capacity to reach a mass of people and influence how they speak about topics. You may not reach the most affected people directly. using online platforms because of the nature of the terrain, especially of Eastern Southern Africa, where not so many young people are able to enable themselves to be online and benefit and be online for the right things, because again, it is not so easy to meet the very intended websites that are communicating what should be communicated. But how can we connect, for example, with influential actors in the media, in the health professions, and make sure that there is talkability of things that were online, take them offline through influential others, and then eventually spread this communication? One of the key things that we have to do around CSE is to build public support. How do we build public support? It is to get these voices that are both online and offline into the audiences of young people and adults, to make sure that then CSE and talking about issues of safety becomes normalized. Issues of sexual consent should be things that people talk about, and they are routine and easy to speak about without fear of shame or embarrassment. So yes, I think there is a lot that people who are doing a lot of work that is online can do, working through others who have the capacity to reach masses. And agencies like ours, agencies that are into programming, should engage these groups very significantly, because they build new content, they have social listening capacity to pick what the communities are saying and be able to change narratives in a very long time. Thank you very much. I mean, short time, not so long. Yeah.
Thank you. Amina, do you have any comments about websites meant for young people?
Absolutely. And thank you very much for the question. It is very an important one, especially in today's digital world. Like CSE websites and also online platforms, they actually play a critical role in growing role in filling information gaps for both the young people and also the adults. So in many African contexts, including Malawi, young people are increasingly turning to digital spaces for answers they feel too shy, unsafe, or unsupported to ask in person. So websites like the ones that offer accurate, youth-friendly, judgment-free information, it is something that many young people desperately need. However, it is also important to acknowledge that digital access varies. Not all young people in rural or remote areas have the internet or the privacy to browse these platforms. So this means that online CSC is most effective when it complements rather than replaces community-based and also in-person work. So therefore, there are several ways that online CSC providers can strengthen the impact on the ground, like maybe localizing the content, producing shareable micro content, which like short videos and all that, since most people are most entertained when they see that. And also they offer like trauma-informed and inclusive guidance, whereby many out-of-school youth carry trauma from GBV, early pregnancies, or harmful norms, and content that is very sensitive and untriggering and empowering can actually provide relief, validation, also emotional support to the young people. And last but not least, online CSC can absolutely plug the gaps, but it becomes more powerful when it works hand in hand with the community structures, the local facilitators, and also together we can actually ensure that every young person, whether online or offline, has access to accurate, safe, and also empowering sexuality education. Thank you.
Thank you very much. And there's another question which brings up the issue of early childhood, early adolescence, appropriate contents for CSE, which I think you have already addressed, Elizabeth. In terms, the question was, is it appropriate to include gender in before age of 10? Can you briefly give us an answer? Because I think it's very important to comment on what we are doing and what we know about early childhood and early adolescence contents content that are appropriate for this age group.
Absolutely. Thank you, Esther. I honestly believe that whether they ask questions or we are teaching them about a particular topic, first and foremost, anything can be taught to a younger person. It's how we do it. So you certainly wouldn't give a long PowerPoint lecture to a 6-year-old child. And also, as I said to our colleague who asked the question, that already from infancy, a child is getting messages about gender and what a child of a particular gender is supposed to do, act, wear, behave, play with, those kinds of things. So I think the most important thing that we can reinforce for any adult and also for peer educators is that it's how we address them. So the younger a child is, the more basic the information, the more concrete and specific the examples. And then as they get older and their brains develop, it's like any other learning in school or out of school, that they can understand more abstract concepts as they get older. I know you agree with me, Esther, and I imagine that James and Amina also agree. Information does not harm a child. It does not harm a young person. It's the greatest rationale for why we need to speak about this often and throughout the lives of a young person and adult to build on the knowledge and skills. Thank you. Over to you, Esther.
Thank you very much. We have one more minute, just 1 minute for a last comment. Just to close the webinar, because we're coming to the end of it, unfortunately, because it's opening so many new topics, and I would really like to hear much more from all of you. So will you please make a 1 minute comment, each one of you? Amina, 1 minute.
Thank you so much. So I'll try to keep mine brief. Working on out of school CSE in Malawi, it actually has reinformed for me that no young person should be left behind simply because they're outside the formal education system. One message remains clear, that young people want to be reached, included, and also heard. The barriers that we face are so real, and so is the potential. Therefore, it is not just an educational intervention. It is a rights-based commitment to ensuring that no young person is left behind, or not, or whether in school or out of school. Through the community-based, youth-led, and also context-adapted approaches, we can reach marginalized youth and give them accurate information, support, and the hope that they need. My experience shows that youth themselves, when empowered, they can lead and change, especially when we create safe, respectful spaces for dialogue. So as youth advocates, practitioners, and partners, we must continue to work collectively to actually build an Africa where every young person has the knowledge, the confidence, and support to make informed decisions about their bodies and also their future. Thank you.
Very well said, Amina. Thank you. James.
I don't know how to compete with Amina. Amina has really said everything I would have wished to say. But for me, I think very, very important is to localize CSE. Different countries can call CSE whatever they want, for as long as they appreciate. The name is easy to sell. The translation of CSE in Africa has been one of the key challenges. It is rejected on arrival because of how it is called. So it is very, very important. Two is to recognize the importance of sexual health and well-being as part of the true human development and transformation, especially for low development countries like ours. And then three, enable participation, association, and self-determination. Issues of gender equality and gender justice should be integral as part of CSE, not sometimes, but all the time. Women and girls, men and boys should be showed their place and their capacity to self-determine, such that they make decisions which they truly believe in and can benefit from. Thank you very much.
Elizabeth, you have 1 minute.
I will take 10 seconds. I will just say ditto to both Amina and James. Amazing, amazing comments. And I'll just reinforce to remember that CSE is invaluable. It is not just a human right, which we all believe in, but it is also a key, invaluable part of growing up to be a healthy, happy, well-adjusted member of a community and the world at large. So thank you, Esther.
Thank you very much. But well, we are closing this webinar, and I would like to thank all our wonderful speakers, three of you. And I mean, you have provided a lot of food for thought and a lot of information and topics to carry over to our next webinars. And just to say thank you in behalf of the World Association for Sexual Health, and invite you to follow up next webinars, where we will be talking on another regions which in general are the same. We have the same issues, the same problems, because we are talking about a CSC, which is, as has been said, a human right and a sexual right. Thank you very much, and we hope you will have a very good day, evening, and we hope to see you again on our next webinar. Thank you.